years now. And some of the shortages is what we're going to talk about, particularly in certain areas. We have, no, there are many reasons why there are shortages, but particularly it's the lack of qualified candidates. When we're talking to large healthcare systems or even small clinics, one theme runs similar between all of them is that there are just lack of qualified students, which could run from training education, getting clinicals completed, passing the program, and then really being job ready. And there's just an increased demand overall in the number of people these large scale healthcare organizations want to employ. So overall, the shortage is there. The shortage has been there. And all we are noticing is that there's going to be an increase in the number of people that healthcare organizations want to employ, especially in some of the programs we're going to talk about, which are the entry-level programs, entry-level shoe-in in the allied healthcare space. So the first program I talk about is the Clinical Medical Assistant Certification Program. These are individuals that could work in clinics, hospitals, or even private practices. They are assisting physicians during the patient examinations or even procedures. These are the individuals that are taking vitals. They are collecting patient information, updating information, measuring it for accuracy. And it might even be somebody that's scheduling appointments and maintaining medical records. All of these different skills are very in-depth. They have to be detailed. They have to be handled with care and privacy. They have to be done with a lot of attention. So our program prepares the students to be ready to sit for exams for the Clinical Medical Assistant Certification. Our CCMA, as we call it, is with the credentialing office named NHA. So you may be aware or familiar with that or have heard about NHA in the past. Going and looking at the nationwide demand for medical assistant. So these numbers have been taken from the data source mentioned right here, Career One Stop, and it is nationwide data, and it's a few years old. However, it's projected employment that is most important to see right now. Overall, in the U.S., there are about 447,000 CCMA jobs, and that number is expected to change and grow into almost 469,700, so roughly 470,000. The annual projected job openings is about 43,000. And once again, as I mentioned, this is an entry-level position in healthcare. It does start off at some of the averages mentioned to the left here. However, please note these are all annual averages. They are not they're not specific to any city or state. And since they are typically the entry-level position there's a lot of movement of individuals that are starting off as CCMA and then moving into other parts that the hospital or organization or large healthcare system may offer. So there's continuity in the number of demand for this type of position, in addition to a percentage that's expected or projected to grow over the next 10 years itself. So there's a lot of demand out there for somebody that wants to get into healthcare and wants to be part of CCMA. The next program is our pharmacy technician program. So individuals that want to be working not so much in a large healthcare system, but want to as pharmacists or want to work in the pharmacy department. This is a program that will help you get that particular position. This program helps prepare packages for medications. This includes counting pills, labeling bottles. Of course, there, as mentioned previously as well, these are positions that require a lot of detail, lot of attention, and of course, maintaining confidentiality and privacy of the patient or the person getting their prescription filled. So the level of accuracy for maintaining inventory and ordering supplies may also be part of this position. However, the list may increase or decrease based on the type of position you land. The certification, again, the CPHT is with NHA. So that is our credentialing body that we work with. Within pharmacy technician, as of 2021, there were 447,000 roughly employment opportunities. And that number is also projected to increase over the next 10 years to about 470,000. So there's about a 5% increase in that position as well. Annual projected job openings is about 43,000. Once again, on the left, there are the different pay bands. Again, as I mentioned, these are all entry-level positions. So you may be starting off at these salary points, depending on your geographic location and your city and state. However, we do see a lot of people starting in these positions and then moving into different areas over time. Moving on to one more program that I'm going to talk about, and that is our dental assistant. So dental assistant could work in clinics, hospitals, or even private practices. These are individuals that are preparing patients for examinations. They may take vitals, they may collect patient information, schedule appointments, and maintain records. They may also run tests, some lab tests, or they may administer medications as well. So if you go in and somebody's taking your x-rays, when you go into the dental office, this could be that person as well doing that. So again, depending on how big or small the dental practice is, the level of responsibilities may change. The demand for dental assistants is really high. Currently, as of a few years ago, there were about 358,000 employment opportunities, which is expected to increase by 8%. So it's higher than some of the other programs we have looked at. The annual projected job openings is about 56,000 versus the 47 or 48,000 we've looked at in the past. Additionally, the pay bands are towards the left, and the dental assistant pay bands are slightly higher than some of the other positions. Again, these salaries will vary based on your geographic region, city, and state, but this is what the national average is for now. I did talk about just a few programs today. However, we have a full catalog at Health Tech Academy, ranging from patient care, surgical tech, phlebotomy, as well as sterile processing and healthcare IT certification programs. You could always go to our website, healthtechacademy.org, and we have information listed for each of those programs in a lot of detail, so you can review. Outside of our training and development and curriculum, we provide a number of different services to our students. We want to make sure that our students are successful, they're job ready, they're ready, exam ready, and we want that student to come out passing their exam and starting their first day. And some of the student resources we have, obviously we have our training through our learning platform. But in addition, we have ebooks. So instead of mailing a book, the books are online and they are in digital format. We have discussion forums. We have skills videos for those that want to really understand a particular concept in a little bit more detail. And we provide exam prep material. And we are very much in touch with our students via email, chat, Slack, text, as well as we have a phone number if anybody wants to call our student success department. Outside of a student success, we also provide career services. So as I mentioned, we want our students to be job ready. So our career services team is providing our students one-on-one assistance with resume writing, interview prep, helping them build a professional profile, and giving them the essentials that they need to be confident, to be ready, to go out and really present themselves and put their best foot forward. I wanted to share, this is one of my favorite parts, is the success stories that some of our students have talked about and have written on Trustpilot, on what their experience has been with Health Tech Academy and our certification and bootcamp programs. Feel free to check that out. I think it's always nice to kind of get somebody else's perspective as well on what their experience has been. And what I would like for all of you to do is, if you would like to talk to one of our admissions advisors, please take out your phone, scan the QR code here, and fill out the form. It takes less than a minute, and we will have somebody reach out and talk to you about the various career options that we have available. I will keep this up for just a little bit so that you can scan and you can take a picture to get you to the website itself. And with that, I will open it up to any questions. Feel free to add them to the chat. You're more than welcome to go to our website as well. There's a phone number there, as well as chat, as well as email. And we welcome all questions, comments, thoughts. We really want our students to be successful, and we encourage everyone to please feel free to go and apply. I do see some questions. So the one question from KK is, what is the average tuition cost? The average tuition cost is $3,450 for our programs. The way we do have various different payment plan options, as well as discounts for paying upfront. Definitely want to encourage you to talk to one of our admissions advisors that can really guide you through our different various payment plans and installment payment plans. But that is roughly right around right under $3,500 is the cost of the program. And then we have a second question: how does the clinics portion work for surgical tech program? So we do have partnerships with the large scale as well as clinics throughout the country on getting our students to come and complete the clinical portion for the program at their facility. Now for specifically for surgical tech, depending on where you're located, we can guide you to some of the partnerships we may have in that particular state. And then you can apply to be part of their clinical program. Again, thank you all for joining today. If you have any question, feel free to go to our website. There's a chat, phone number, and email that you can get in touch with us by. And our website is healthtechacademy.org. Thank you so much for making the time today. We appreciate you and your time. Bye-bye.